6 weeks in the UK for a cardiology referral. She finished a full cardiac CT in Chengdu before lunch. I'm Emma, a medical concierge in Chengdu, China. Margaret is 61, from London. She'd been experiencing occasional chest tightness, and her GP had referred her to a cardiologist. The NHS wait for her initial specialist appointment was 6 weeks out, with imaging potentially adding another several weeks beyond that. Her private insurance had a high excess. She decided to look at what was possible abroad, and landed on Chengdu after reading about the diagnostic options available here. She flew in on a Tuesday evening, and we started Wednesday morning. 7:45 a.m. I met Margaret at her hotel, 10 minutes from the hospital. She'd prepared her referral letter and recent blood results, which I'd asked her to bring in advance. We walked through what the morning would cover on the way in. 8:30 a.m. Registration completed. I had the translated intake notes ready and guided Margaret directly to the cardiology imaging floor without waiting in the general queue. 9 a.m. Pre-scan consultation with the cardiologist. I translated the full conversation, what the CT would capture, the contrast dye process, what to expect during the scan itself. Margaret had 2 questions she'd written down at home. Both were answered before she went in. 9:30 a.m. The cardiac CT scan itself took under 15 minutes. Margaret told me the most surprising part was how quiet it was. "I'd built this up in my head for weeks," she said afterward. "I was ready for it to be frightening. It wasn't anything like that." 10:15 a.m. We returned to the cardiology consultation room for a preliminary review. The radiologist's initial findings were discussed with the cardiologist present, and I translated the summary in real time so Margaret could ask questions directly. 11 a.m. Full written report confirmed for digital release within 24 hours. I noted the collection process and scheduled the follow-up translation session. 11:30 a.m. Margaret and I had lunch nearby. She said she felt lighter than she had in months, not because of the results, but because she finally had a clear next step. In London, Margaret was looking at a multi-week wait just to be seen by a specialist, with imaging scheduled separately. Here, the consultation, the scan, and the preliminary review happened inside a single morning. The full report was in her hands the following day. If you're waiting on a cardiology referral and want to understand what the Chengdu process actually looks like, send me a message. I handle the logistics. The medical decisions stay with your doctors. Day with Emma, Medical Concierge.